All right, so we're gonna go ahead and jump in here, show you this patient. You can see she is a young teenage patient with a pretty pronounced underbite. You can see the lower teeth stick out in front of the top teeth, as well as she's got quite a bit of crowding. You can see the canines here are mostly blocked out. So we'll talk you through the decisions we make on how we treat this patient, the different options we had, and why we chose the ones we did. So treatment options for underbite include elastics, extractions, and sometimes jaw surgery. So jaw surgery wasn't something that this patient was really interested in. We'll show you just a quick video of kind of what a jaw surgery would look like for an underbite. It is a good option for certain patients. You can see rather than moving the teeth to fix the underbite, braces get the teeth straight, and then with surgery, the bones of the jaw are actually moved. So you can see the lower jaw is set back, and the upper jaw is brought forward to help fix an underbite in this case. So this is a good option for certain patients. For this specific patient, we didn't feel like it was necessary. Her bite, she did have a pronounced underbite, but it wasn't so severe that we couldn't get a good result without surgery. So since surgery wasn't something that we were considering, we looked at the alternatives. So elastics, if we wanted to fix an underbite with rubber bands or elastics, this is how the process would work. When the braces are on, you hook up some rubber bands from the top molars and you stretch that down to the lower canines. And over time, this helps to pull the top teeth forward, bottom teeth back to help correct that underbite. This can be effective in more of a mild to moderate underbite. In this patient, we didn't feel like this was going to be enough to get full correction of her underbite. There were some limitations, and teeth have a limit on how much they can move with just elastics. And her bite was a little bit beyond what could be expected to be fixed with just rubber bands alone. So the next alternative is tooth extractions for underbite corrections. This animation will show how that works. So by taking out certain teeth, in this case it was the lower bicuspids and the upper second bicuspids, and then using braces we can guide the teeth into these extraction spaces, pull the bottom teeth forward, help pull the bottom teeth back, top teeth forward, and then as those spaces close, that will help to correct the underbite. So that's what we chose to do in this patient's case. We had these lower bicuspids taken out, the lower first bicuspids, and the upper second bicuspids taken out as well. So that was because she had that severe underbite, but also because she had quite a bit of crowding. So if you can picture, if we were to just put braces on this patient and try to engage all these teeth with the wire, what's gonna happen is this canine is gonna stay right where it is. These lower front teeth are going to flare even farther forward and actually make her underbite quite a bit worse. So that's something that many people don't understand, that they say, can't you fix it without extractions, with leaving the teeth in? And straight teeth is something that we can do, but the direction, the location of the teeth may not be favorable after we get everything straightened out. So in this patient's case, we felt that 2 teeth extraction on the lower, 2 on the upper was going to give us the best result. So again, this is the patient. You can see she had that pronounced underbite, quite a bit of crowding top and bottom. And this is where we got her when she was finished up. You can see she had a tooth extracted here and right here. By extracting that lower canine, we were able to pull all these front 6 teeth back into that extraction space. And then we took out that tooth back here, pulled these back molars forward. And so by the time we were done, the space was entirely closed. That underbite was fixed. You can see she had a nice smile. So we'll jump in and look at some before and afters. This helps to show just how much correction we can get with extractions. You can see by taking that tooth out here and pulling this tooth back in there, we were able to keep these front teeth from flaring forward further. And then same thing here, we took out this bicuspid back there, which allowed us to slide the molars forward, help bring that canine down into a good position. By the time we were done, no one besides me and her dentist is ever gonna know that extractions were done. A lot of people wonder, is this gonna make my face look flat? Is it gonna change my jawline? In most patients, taking out teeth actually improves the profile, improves everything, because she just simply did not have enough room for all of her teeth in her mouth. And if we tried to fit them in there, they would actually end up flaring forward too far. It would make her lips more protrusive than they should be. So in her case, this was very beneficial, and in my opinion, the best treatment plan as well. So that is about it. That is how we treated this patient. There are lots of ways to treat underbites. Not every patient will be treated the same way. In this patient, we determined extractions was the best method. Sometimes extractions might work better, sometimes it's elastic, sometimes jaw surgery may be the best option. That's really where the orthodontics experience comes into play and their expertise, and they can advise you, if you have an underbite, which one of these options may be the best for you. So if you have any questions, feel free to ask them in the comments section below and we'll do our best to answer. If you're new to the channel, make sure to subscribe for more braces related content. If you found this video helpful, please give this video a like and tap that bell for more notifications. Thank you so much for watching, and we'll talk to you soon.